The DHB system is totally unjust for those suffering from the late effects of polio. And I say it's unjust because currently each DHB has their own budget. They make their own decision where their money is to be spent. The result is that it all comes down to where you live. I'm saying that is unjust, because we need to go across the board in New Zealand. We've had many associated QE Health in Rotorua, haven't we, where polio people can go and get a comprehensive assessment of their disability or any other problems that come from polio, and they will supply appropriate programs which can assist them in staying mobile as long as they can, and be independent. Now, the problem is because each DHB decides, it means that some will say, yes, you can go to that and receive that program, and others will say, no, you can't. Now, where is the fairness in all that? I would like to see them take on a universal approach to it all, meaning that everybody can have access to it.
The reason that the DHB said no, they wouldn't send them to QE, is because the DHB believes that they can deliver the services that the person with the late effects of polio needs. But the truth of the matter is that they don't, who don't actually understand what is required. So it's the lack of understanding about the late effects of polio that it's their own ignorance that's actually getting in the way.
So basically, this is a neurological facility that we have there. We've had a long association with them. They do a comprehensive assessment of just where we are, because there are people who understand polio, have over the years, and they give you the appropriate programs which can assist you to stay as mobile and as independent as you can in your own home. Now, the big crunch here is, of course, is if you don't live in the right DHB, that jurisdiction, you don't get anything. So how fair is all that? Now, if we had a universal system whereby the health system funded, rather than each DHB, every DHB has to say, yes, you've got to do this for polio sufferers. Now, at the moment, that doesn't happen. You can live across the border from one, not get it, the other can get it. So what I'm saying is, why don't we look at the polio people and those with neurological disabilities? Why don't we look at them and say, this is a universal thing. It's got nothing to do with each individual DHB. This is the amount of money we're going to give to them, and it's worked out on a proportional basis. So there is money there for us polios to be able to access these places. People from anywhere in the country who suffer from the late effects of polio or neuromuscular problems can access. We're not getting that. The money should come from the health department budget, which says that, yes, we recognise this problem with polio, late effects of disability, and come up with the amount of money to spend, right? And then that will be distributed amongst the DHBs if we're going to stay with that number of DHBs. And so at least there is some money there for some help. I only bring up QE, of course, because that's where we've been before, and that's where we get the maximum amount of care. There will be other places eventually. Take us through the whole process of assessing and then working out a program for our people, so they at least know they can get assessed as to how they're developing each year. And I think that's the fair way. But to say to somebody across the border from a DHB's jurisdiction, you can't go because we've decided you can't go, totally unfair. We realise there's no bottomless pit in all this. But meanwhile, what's Polio New Zealand doing? Well, we're working on funding. We're working on pathways which take you from your assessment through to what care can be given, what help can be given, and all that sort of thing. We're not sitting around waiting for somebody else to look after us. But QE's been sitting there with the expertise, and we haven't been able to access it. No, you're not in the right DHB, sorry, bad luck. We are actually being proactive as well in trying to get funding. But at the end of the day, why would we, as when going to the public service, have to endure the fact that we don't live in the right DHB? That's not right.